are seeing a lot of infertility on the rise, and this is kind of it's explainable. If you look back into your previous generation, that is your parents or their parents, they never had infertility issues because the age of marriage was younger and there was no use of any kind of contraception or avoiding pregnancy for 2 years, 3 years, 5 years, and so they would finish their family within 25, 26, or maximum 30 years of a woman's age, and so the infertility problem was not really kind of tackled by them. Now what we are experiencing is that the infertility is rising because of this reason. The marriage is happening late, and the couple, they want to start their family little late because they want to settle. They have their own ambition. They want to achieve few things, and only after a certain stage they want to go ahead and plan about the pregnancy. But did you know that if you are aware of the early signs or symptoms of infertility, then you can take control of things and you can secure that by having that right kind of knowledge and the right kind of understanding, provided you seek help at the right time. And you can do so by visiting the consultant, the fertility consultant, if you are aware of the early signs of fertility. So today I want to delve a little deeper into what are those different fertility, early infertility signs that a woman or a man can pick and then seek that medical support or seek the medical help at the earliest, so that you don't feel that you have not taken the right treatment at the right time. So, hey, hi, I'm Dr. Indu from Samrudh Fertility and Urology Centre, and let us dive deeper into what are these early signs of fertility. Now, I'll be enlisting few of the early signs of infertility in women. So, the most common thing that we come across is number one is the irregular cycles. Now, irregular cycles is something, some of the women might take it as a boon that okay, they are not getting it on time, so it's okay, they don't have to worry about using pad, the pain, the bleeding, the clots, and all those things. But remember, if you are someone who wants to try for pregnancy and that is there on your goal list, then having irregular cycles and taking the right treatment or the right guidance at the right time is extremely essential. Now, when I say irregular cycles is if you are getting menses once in 45 days, more than 35 days, it can be 35 days, 45 days, 60 days, even 3 months sometimes, and some of the women rarely may get only on taking medication. I come across a few women who are happy not having menses for 8 months, 9 months, but they don't realize that they need to get the menses initiated by taking medication, and this guidance is extremely important to also protect them from future cancer risk. So don't take this symptom light, because if you are planning for pregnancy, then the irregular cycle is not going to be in favor, because in irregular cycle what happens is your hormones, which should be released in a cyclical manner, okay, this is what happens in the women who have regular menses, this is disrupted. You do not have the cyclical release of hormones which come from the brain, and so the ovaries are not getting stimulated to make that follicle grow, become mature, become an egg, and all those things. So that's why you are having a challenge with ovulation. So don't you think that if your cycles are very irregular, you must seek medical support at the earliest, so that you know what action to take. If you have any correctable action, that can be utilized at the earliest. So remember to seek medical help the moment you know that your cycles are really irregular, and see a fertility expert and understand what actions can be taken. So the second sign of fertility challenge that you might have is if your menstrual cycles periods are coming in a very short period of time. If your cycles are happening once in 20 days, 21 days, 24 days, then this is actually, the nature is hinting towards you having the ovarian reserve on the lower side. It is possible. So, this particular pattern of a very short cycle generally is noticed just before you stop your menses completely. That is just before menopause, or we call it as perimenopausal period, where your cycles are getting shorter, shorter, and then you gradually stop. If this pattern you notice early in your age, that is at age 25, 26, even 30s, then I think if you have not started to think of pregnancy, but then if you are having this, then do consult a fertility expert and understand two things. One is a scan and another is a blood test to understand what is your ovarian reserve, and you'll get your answer, and you will know that okay, where you stand. Should you be postponing your pregnancy to a later date, or should you do something? Should you do egg freezing or embryo freezing if you are married, and take control of your fertility? If you don't have this information, then I think you'll miss it. As I said in the beginning, that such women in the olden days would have finished their families by the age of 30, but you are beginning to start with the thought only at age 30, 31, 32, and by then the reserve would have gone down drastically. So if you are someone who's having cycles very short, then remember it may be a sign of low ovarian reserve, and get that cleared by consulting the fertility expert. Coming to the third sign. So if you are having extremely painful menses, and you have been having this painful menses from somewhere from early 20s, and you are taking medication to get the pain relief, and you are doing this every month, then this is something that you need to consult with a doctor and find out why you are having so painful menses. Because if you are someone who is now 24, 25 years old, you are planning to get married, or you are married but you want to avoid pregnancy for next few years, but with the presence of painful menses, you are have to take you are taking medications, painkillers to get that pain relief every month. You are missing office, you are missing work, your routine is getting disturbed. It is again hinting towards a pathology which is called as endometriosis. It is possible that you might be having this condition. If you have this condition, then what it does to the fertility of a woman is that you may take a longer time to achieve pregnancy. The time taken to pregnancy may get longer, and at the same time, if this gets diagnosed, then the ovarian reserve may prematurely come down faster compared to those women who do not have this condition. So, painful menses is something that needs attention, and if it is recurring and you have been noticing that it is happening for last 6 to 8 months, then definitely go and get yourself checked and assessed if you are having this particular pathology. If you have, then do have a chat with a doctor as to how you should go forward in planning your pregnancy and achieving what you are desiring. So the other reason is if you in your family, your mother or grandmother had early menopause. When I say early menopause, if the menopause is happening less than 40 years, then you are someone who is going to have the same thing. So then, as I said, for them it was like completing the family soon. But you are someone who is not even thinking of starting a family at age 32, 33. And then when you really want to start, suppose let's say you're starting at age 33, 34, then with this history you may be landing up in a situation where your ovarian reserve is really very, very low, and it may become very challenging to achieve a pregnancy. So if this history is already there, then you need to find out from your mother, or if you know it already, then it is good to discuss about this particular aspect and talk to your fertility consultant and know what is your ovarian reserve for whatever age you have started to think of pregnancy. You need to know what is your ovarian reserve, what is the stock of egg that you have got. Suppose you know this information even before marriage, then it is good idea to even consider egg freezing in that case. And if you have married and you're not wanting to try for pregnancy because you're not ready physically and emotionally yet, then you have to consider even embryo banking, which will secure your fertility aspect. So, better to know this history if it is there, and then take the right action by consulting the fertility expert. So coming to the next reason or sign of early fertility, there is sometimes women go through some ovarian surgery even before their marriage. And if you are someone who has had the surgery in the past on the ovaries and some cysts were removed and you were given some kind of treatment, it could be chemotherapy treatment, sometimes radiotherapy treatment, then this is going to impact your ovarian reserve. Or if the ovary was completely removed for some reason, such as you had a torsion of ovary, ovary just rotated, you had gone with extreme pain, and they have removed that ovary because it was not salvageable. So then you are left with only one ovary. If you are having this history in the past, and then now you are contemplating pregnancy but not so soon, you want to delay it, then this important history should be brought to the doctor's notice, or you should go and discuss this aspect with a fertility consultant and understand what is your current ovarian reserve status with the ovary that is remaining, or with the other ovary which had that operation but you have very less reserve in that ovary. So in that case, better that you have that clarity on what is the egg stock that you have for future, and is it possible for you to push your pregnancy, motherhood to a later stage. Do you need embryo banking, or do you need egg freezing? This is something that you need to understand. So this particular history in the past is extremely essential to understand about your future fertility. So take control of that by consulting the fertility expert. So coming to the sixth sign in women, if you are someone who is having a lot of fear or a lot of anxiety, or I would say a lot of fear in doing intercourse, and you're not able to cooperate at all because you have this condition called as, it could be a condition that you might be having called as vaginismus, where you tend to contract your pelvic muscle too hard, and this doesn't allow the normal intercourse to happen. If you are facing this issue, then yes, if it is not attended on time, then you might be facing the fertility challenge, as this is self-explanatory, right? So this particular condition actually needs a kind of a multidisciplinary approach, where you need to be counseled by the counselor, you need to be dealt with by the gynecologist with the simple conservative therapies that the gynecologist will be telling you. Because if this is not corrected on time, then you may need to resort to assisted treatment for fertility, like IUI under anesthesia, or IVF and embryo transfer under anesthesia. I have seen so many couples coming with this issue and getting the treatment done with the mode of either IUI or IVF. So if this issue you are facing, then do not ignore it and do seek the medical help at the earliest. Now, coming to the last point, that is the seventh point on the signs of early signs of fertility. So now here, if a woman is very obese, and along with that, she's also having excessive hair in the abdominal areas. When I say abdominal areas, it could be excessively on your upper lip, chin. It could be on your cheek. Then it could be over your nipple area. Then excessive hair over your back and the lower abdomen, upper thighs. So, plus along with that, you also have darkening of skin, especially in the nape of your neck, the folds, that is the axillary fold, that is underarms or upper thighs. You have darkened, rough skin. Then this is a very combination, a deadly combination of a severe hormone imbalance, and this might be needing attention not only from the gynecologist, but endocrinologist also has to come into picture and understand and give a holistic treatment. If this is not tackled at the early stage, then it becomes difficult to treat it later. So if you are having this combination of excessive weight, darkening skin, lot of hairs, then this is all reversible if you are taking action at the earliest by consulting not only the gynecologist, the fertility expert, but also having a consultation with the endocrinologist. So this will be like a teamwork. So if you are seeing these symptoms, then yes, this is also a sign of you having fertility challenge. Now coming to the early infertility signs in men. So one of the most common thing that as fertility expert that I come across is men having erection issues. We call it as a erectile dysfunction issues. So this may, in this category, then, if you are really. So now coming to the early signs of infertility in men. The most commonest thing that I come across, or many fertility expert come across, is men having low sexual drive, premature ejaculation, erection issue. This is all called as erectile dysfunction. Now, if you are someone who is going through this problem, then I think it is understandable that this is going to be a challenge to achieve a pregnancy. And if this is not attended at the earliest, this is going to kind of increase in intensity, and it will be making it more difficult for you to achieve pregnancy in a natural manner. Now, why this issue you are facing, you need to understand and go to its root, because if it is tackled at the beginning, then you have a lot of time to take action. If you don't do anything for a longer period of time, and you think in your mind that okay, this can be seen at a later point, then what happens is when you really want to start the family, then you are in a hurry. You want to achieve that faster, and everything comes together, and you are not able to relax. So things become really vicious. It becomes more deeper and deeper. It gets more problematic. So the moment you realize this, that there is an issue with erection, do not kind of ignore it, because to sort this out either by counseling or by giving medication, it takes time. It may take up to 6 months to years time. So there might be so many things that is that can be handled by just the right kind of counseling, provided you seek that support when you find this problem. So do that, so that at least you give yourself time to have a correction naturally by just counseling or some medication for a temporary period of time, and this will help you to achieve pregnancy in a natural manner. If that is not happening, then you have assisted reproductive techniques uh, to help you achieve pregnancy. But then most of them do not take action on time, so don't do that. Take action, and the moment you realize that this is really getting bad to worse. So the next sign would be if there has been a history of you going through a lot of pain in the testis, or there is a sudden increase in the size of the testis, or you are feeling some heaviness in the testis, some dragging sensation. So I think this particular symptoms needs attention. You may be having few issues. It could be infection, and infection, if it is not dealt with immediately and you leave it unattended, then the infection in the testicular region might have an impact on the tube that carries the sperm from the testis to the penis. So that ejaculatory duct may get damaged, and this passage, if it is damaged, then it might get blocked, and this might lead to obstructive azoospermia, or you may not have any sperm coming in the ejaculate. So this is one thing when you are experiencing such a thing of pain or increase in the size. The other reason that could be attributing or contributing will be you are having dragging kind of a pain. So it could be a sign of you having those dilated veins around the testicles. This, in medical terminology, we call it as varicocele. Now, if this condition is there, then again, to what degree this condition is existing? If the degree is milder, then it is actually left alone. No medical surgical management is given. Surgical management for varicocele is done only when the varicocele condition is of a severe degree. Again, here I want you to understand that if you are considering pregnancy and you are young in age, your wife is also younger, she is having good reserve of egg, then getting the varicocele surgery done will be really feasible, because after the surgery you need to wait for minimum 8 months to 1 year's time to understand what is the kind of improvement in the sperm quality you have got after the surgery. So it all depends upon at what stage of what is your age, what's your wife age, what is her reserve, what is her egg reserve. So many things come into play when a decision of surgery has to be taken. So one important thing is that a surgery should be done only if the varicocele degree is severe. Otherwise, it may not need a surgical correction. So this is something that I would like to definitely educate you upon. So coming to the next sign. Now, if you have had history of any surgery in your childhood, especially undescended testis, then this is a sign of you having only one remaining testis, and then getting your semen analysis done and understand whether you have the good count and motility and everything is normal is very, very essential. Because the one surgery that you had, the testis that was not residing in the testicular sac, but it was somewhere up in the abdominal cavity, and that is not the place for the testis to say stay, because if the testis is staying there in the abdominal cavity for a longer time, then all the reserve, the future reserve of sperm that was supposed to be in the testis would have got damaged. So the testis is actually removed whenever it is kind of diagnosed that it is actually staying in the abdominal cavity. So with this background history, and you get to know, and now you are kind of thinking of achieving pregnancy, then better to get an analysis done to understand if it is all normal or not. If it is not normal, but then pregnancy is something that you're not looking for right away, freezing the sperm will be a better option. Likewise, if you have had any surgery for your back, especially the lower back, that might have an impact on the erection, especially, and this there might be issues with the erection and collecting of the sample or even having intercourse. So even this is a very important history that has to be brought to the doctor's notice. Obviously, when you go to the doctor with this, then you will be given the uh, next step to be taken. What is the next action steps that you need to take? So this is about the surgery. Or if you've had any accident in the past where your lower back is damaged, then again the same symptoms you might be encountering. So these are the early signs related to the history of surgery in the past. So again, a previous history of cancer. If any history of cancer in the childhood, the commonest thing that childhood cancer that one comes across is blood cancer, or if you've had cancer related to the testes, or if you've had the treatment of radiotherapy, chemotherapy, then this is all going to impact your reserve that is there in the testicles. So this history again gives you a kind of a clarity, or it will give you an understanding that this history is there, and you need to know what is happening right now in your adult stage, whether you have got sperm that is all normal, or it is compromised, or there is no sperm found. So this understanding you need to have, so that you know what actions to take, or what is the next step that you need to take when it comes to starting the journey of parenthood. Sometimes some of the gentlemen, they will have a challenge with the foreskin on the penis. It is actually, it doesn't retract back easily, or it is very painful to retract back, and such men might have difficulty to pass urine. They might have difficulty to even have ejaculation or masturbation. And if this is not attended and it is ignored, then this might lead to, or there is a possibility of infection happening. And if infection happens, then it is going to damage the tube that carries the sperm, resulting into obstructive azoospermia. And the challenge will be that, okay, you have to do the correction, you have to see what extent the obstruction has happened and all those things. So if you have issues related to the foreskin of your penis, then it needs attention. There have been patients when they come so late after marriage, and they are realizing it so late that the so there are situations where men have not taken this particular symptom very, they have not taken action when they are noticing this symptom, and they delay it for a very long time, and this will definitely impact the fertility. So when you know, then do not shy away from approaching a doctor, approaching the urologist or an andrologist, and get this surgery done and get that foreskin removed, so that you do not have difficulty in either having intercourse, or when you are passing urine you should not have that difficulty. So this is another important aspect that the gentleman should understand and take the corrective action at the earliest. If the man is on the heavier side, very obese, you're having dark skin over your neck, back of the neck, over the underarms, in the inner thighs, and severe abdominal obesity, then you are you should realize this that you are having severe hormone imbalance, and you need to be dealt with not only by the urologist or the gynecologist if you are facing fertility challenge, but also by an endocrinologist, because you need a lot of support, a lot of counseling, and a lot of help to tackle this issue, so that you reverse this situation. So most of the time, if you are taking action to lose weight, and losing weight by 5 to 10% of the body to begin with really will do wonders. But if you continue the journey of losing weight, then all this problem of darkening of the skin and the severe form of hormone disturbance that you might be having will get reversed. So taking action at the right time is really essential, and that will really reverse the condition. So I have extensively covered around what are the early signs of infertility in men as well as women. So I think if you just go through these reasons, most of them are something that can be tackled with, and you can overcome the challenge. There are only few which wherein you cannot do anything much, but many of them you can handle it very effectively, and you can overcome the challenge of the obstacle that you are facing related to fertility and achieving a pregnancy. So, if you are someone, if you are a couple who is having any of these issues, then do not hesitate to seek medical assistance, guidance to understand what should be your next action step and what should you be doing to take control of your fertility. And if you think that this information was useful, then do share it with someone who needs it, and do also subscribe for more such fertility tips and health tips, which I'll be doing in the coming days. So thank you so much for watching, and I shall see you soon in the next video. Bye.